Hello everyone, this is your Sahusa in front of you with a new topic, and today we will discuss the topic that is called as health programs in India. So this is the topic which we are going to discuss today. Let's start the topic. First of all, we require the introduction. So under this introduction, we will discuss that our India has increased increased the share of expenditure on health around around 3.9 percentage from GDP in the year okay 2011. So means our India has been increasing the share of GDP towards betterment of health facilities. Means upon the health services, our India is expenditure is increasing more from GDP 3.9 percentage from GDP is allocated to the health services, and this is a good sign of economic development. Why? Because in the previous we have been discussed, health is also one of the major constraint for the development of economy, right? Better quality of life, right, as well as living standard will also improve. So our India has increased the share on health services. So in the same way, the government has brought out some sort of programs in the 11th 5 year plans. 11th 5 year plans, the government has introduced some sort of programs, and the major first two programs, that is National Rural Health Mission. This is called as NRHM. Next, number 2 is National Urban Health Mission. This is called as NUHM. These are the two major programs, along with some other programs are also there. We will discuss, right? So, most probably, let us discuss one by one. Under that, number 1, that is National Rural Health Mission, NRHM. Let us discuss about this topic now, right? So basically, if you see, already the name itself is suggesting what it's suggesting here, where the medical and services services which is provided in the rural areas. Yes, rural areas, because the name itself is suggesting national rural health mission, the medical or health services which is been concentrated on the rural areas. How it is been providing, let us see. So here they have taken some sort of initiatives, that is number 1, 5 lakhs Asha centers. 5 lakhs Asha centers, which is want to be established by the government. What is this Asha centers? Let us see. accredited social health activist. Okay, so in the villages, most probably this is related to the villages. So in the villages they want to establish the 5 lakhs asha centers. You know the asha workers, they used to wear the white saris and they used to come and inquire in each and every house. Anybody is there in fever or cold or any pains or anything like this, they used to come to each and every house and they used to make the survey if any person is ill or not, right? Every house they used to visit and they used to do the enquiries relating to the family members health. Yes, in the villages most commonly we used to see it. So the government wants to establish this 5 lakhs ASHA centers. And next, number 2, the government also wants to establish the sub-centers. Sub-centers. So under these sub-centers, okay, here the government wants to establish 2 ANMs. That is auxiliary nurse midwives. So here in the sub-centers, definitely 2 nurses will be always available. After that, number 3, here, that is primary health care center. Primary health care centers. Simply we used to call it as PHCs. So here the PHCs are being present in every village, and in these PHCs 3 staff nurses, and they used to available 24 into 7. 24 into 7, these staff nurses will be available. 24 hours, 7 days a week, 3 staff nurses always will be there in the primary healthcare centers. Okay, now one nurse is 8 hours, after that another nurse for 8 hours, and next another nurse for 8 hours. In the shift wise, they used to perform the duties, but the nurse will be definitely available. Right? And next, number 4. Number 4 is, here we used to call it as 6,500 community 6,500 community health centers will be established by the government. And in these community health centers, 7 specialist doctors and 9 staff nurses will be always available. 7 specialist doctors and 9 staff nurses always will be available, and remaining all ASHA centers, sub-centers, primary health care centers are connected to community health center. And if necessary, community health centers related doctors, they used to visit to the primary health care center also to give the medical treatment if it is been required. Okay, na? After that, next number 5, 1800 taluka hospitals. So the government wants to establish the taluka hospitals. 1800 taluka hospitals will be available, most probably, equipped with the nurses also, as well as number 6. District hospitals. So district hospital, here all specialist doctors as well as nurses will be available round the clock. round the clock. Government doctors as well as the nurses will be available round the clock here. Okay, so this is the framework which is being carried out under the National Rural Health Mission, right? So here, district hospital, he used to manage the community health centers as well as the taluka hospitals, and community health center manage the primary health care centers, sub centers as well as the ASHA centers will be managed by the community health centers, right? So each and everyone is managed by each and every one. ASHA centers managed by sub centers, sub centers managed by primary health care centers. It is been managed by community health centers. Taluka hospitals is also managed by community health care centers, as well as all community health centers will be managed under the district hospitals. So it is a chain wise, each and every hospital is being managed from one to each other to provide the better health facilities in the rural areas, that is the villages, mandals, districts level, right? So this is related to National Rural Health Mission. Okay, and now we are discussing the next topic, that is national, okay, number 2, National Urban Health Mission. Let us discuss this topic, National Urban Health Mission. So the name itself it is suggesting means health services which is provided in the urban areas. Now there is a twist, that is in urban areas mostly the medical facilities are provided in the slum areas. Remember the slum areas? Most probably in the slum areas we used to see the laborers as well as the workers and the daily laborers and dwellers. They used to live in the slum areas, and here there is no sanitation facility as well as no drainage facility. No drainage facility as well as the sanitation facilities, and there is no pure drinking water facilities is been available, and due to that they used to get many diseases, and they used to cure these diseases in the urban areas, especially in the slum areas, by establishing the PHCs, that is nothing but primary health care centers. Okay, and here they used to provide the free medical facilities to the general people, especially the workers, dwellers as well as the laborers, because they don't have the money to visit in the big hospitals, private hospitals. Normally to go and come in a one private hospitals, okay na, unnecessary 1000 rupees will be gone off. Okay, right? They used to charge many money. That test, this test, that test, remaining so many tests they used to conduct it for a normal fever, because it is completely commercial where poor people cannot bear it. So for that persons, here the primary healthcare centers has been established by the government to provide the good medical facilities out there. Okay, now next after this we will discuss number 3. Number 3 under this health program, that is Janani Suraksha Yojana. This is another program under the health programs in India, and very important program also. Janani means pregnant woman. Suraksha is nothing but protection. Yojana is nothing but scheme. right? Pregnant women are protected under this scheme. How? Especially 100% deliveries, 100% deliveries, they used to do it in the hospitals, hospitals by experts. By the expert is nothing but by the specialist doctor. Okay na? Gynecologists will be there na, gynec related doctors, and with the help of those specialist gynec doctors 100% deliveries will be carried out, and they want to decrease the maternal mortality rate. Remember in the previous we have discussed maternal mortality rate, they used to be reduced. In the same way, another protection, okay na, next protection, the next protection to infant, okay, because here infant mortality rate also they want to be decreased by providing the good medical services, by providing the good medical services. Okay, so here most probably our country has taken out many medical related health related schemes, health related schemes, many schemes established by the government. Okay na? Under that the Modi government has taken out one scheme is called as Ayushman, Ayushman Bharat, Ayushman Bharat. Under that, up to 5 lakhs medical, up to 5 lakhs medical treatment is completely free. Up to 5 lakhs the medical treatment is completely free. Okay, in the Telangana government also have the Arogya Shri, where they used to provide some 2 lakhs, up to 2 lakhs, the medical treatment, okay na, which is been completely free. So this is the scheme which is been established by the both. Central government has its own scheme, state government also have its own scheme. Okay na? In the same way, the central government also have another scheme that is called as Rashtriya Swasthya Bima Yojana. This is also one of the scheme, RSBY. Under this scheme, according to 2018 and 19, the government has already provided the fund of 2,700 crores for the medical services. For the medical services, 2,700 crore has been provided to provide the good medical facilities here. Right? Okay. So this is a next scheme which we haven't discussed. In the same way, number 4 which we are going to discuss, that is clean drinking water and sanitation, okay, and most probably clean drinking water. This is very important scheme which has been carried over by the government, where the pure and clean drinking water is provided, which is provided to each and every home, because why? Because they want to control the waterborne diseases. There are many waterborne diseases are there, and due to that most of the people they used to die because they cannot bear the expenditure of the hospitals. So the government wants to give the clean water facility to the poor and all persons, and each and every house they used to provide the water connection. For that, the Modi government has taken out a scheme called it as Ghar Ghar Jal, okay, Yojana, Ghar Ghar Jal Yojana. In the same way, in the Telangana, you know it very well, that is Mission Bhagiratha, Mission Bhagiratha, where each and every house they used to provide the water connection, that too free water connection. Did you understand? Free water connection to each and every house. Okay, because why the government is providing all this? Because they want to control the waterborne related diseases, typhoid, malaria, other diseases they want to be completely controlled. In the same way, sanitation, right? Sanitation, which is nothing but cleaning of our nearby surroundings. Okay, if our nearby surroundings are clean, almost we used to have the good health. Yes or no? We used to have the good health. Okay, for that, the central government has been taken a scheme. Remember, Swachh Bharat Abhiyan. Swachh Bharat Abhiyan. Narendra Modi has taken the slogan of Swachh Bharat Abhiyan. Modi government has taken out, because under this Swachh Bharat Abhiyan, they want to keep the surroundings as well as nearby places to be clean. And the government has established some sort of dustbins in all places, where we have to throw those dust, whatever the scrap we used to throw in the dustbins only. Due to that, our surroundings will be remain as a clean. Okay, in our previously what we used to do, okay, when we throw the dust or scrap or garbage, okay, we used to put the target that it should go and fall into the other house, then only we will feel happy. Once upon a time, and there is a big competition, he used to throw, and definitely they used to locate one target, and then only if it falls, then that person will become very very happy. Okay, but now not like this. In the same way, government, that is in Telangana, we used to have a scheme. And that scheme is called as Swachh Telangana. Right? So the KCR has been taken out of this scheme very prestigiously under the Swachh Telangana Abhiyan. Our Telangana should become as a very neat and clean, and we should keep our surroundings as a clean. In your houses, the government has provided one blue bucket and green bucket, wet garbage and dry garbage. Different buckets has been provided, right? And you know the GHMC work. Okay, how the work is being carried out and how the hard work they were doing to clean the Hyderabad, right? And they have taken the very precautionary steps to keep the city clean always. Okay, right? So this is the Swachh Telangana as well as Swachh Bharat Abhiyan, which is meant to keep the surroundings clean. If the surroundings are clean, we will be free from the diseases. Okay, everyone, I hope you have understand the topic. Right, if anything is there, do let me know in the comment section. Right, and don't forget to subscribe. You have to give the encouragement to me. Your subscription is my encouragement. Okay, thank you so much.